When your surgeon or physical therapist gives you permission, begin doing active assisted exercises. You will now begin using the muscles in your healing shoulder or arm, but you will also use your other arm to help. You will need a sturdy wand around 3 feet long, such as a broom handle, cane, or golf club. You'll use the wand to guide and help move your healing arm. Only do your exercises on the schedule provided by your surgeon or physical therapist. It can delay your recovery to do active assisted, strengthening, or stretching exercises too soon. To protect your shoulder, do not do any exercise until your surgeon or physical therapist has shown you how to do it. Follow his or her instructions. Do not move your healing arm any farther than he or she tells you to move it. Do your exercises slowly and gently. You may feel some discomfort in your healing shoulder even before you begin your exercises. But if pain increases while doing an exercise, stop right away and relax your shoulder. If the pain returns to your starting level after you stop the exercise, try it again, slower and with less intensity. If you continue to feel increased pain, even though you've stopped the exercise, talk with a member of your healthcare team before continuing to exercise. For the first exercise, lie down with folded towels behind your elbow to keep it forward. Hold the wand in both hands. Your healing hand is palm up, and your helping hand is palm down. The position of your hands is important to avoid putting stress on your shoulder. Keeping your elbow on the towels, move your healing arm to the side. Let the arm that did not have surgery do most of the work. Move your healing arm only as far as you've been told. Do not move it to the point that you feel increased discomfort. For the next exercise, hold the wand as before. This time, you will move your healing hand above your head. Use your helping hand to assist you. Move your arm only as far as you've been told. Do not move it to the point that you feel increased pain. You can also do this exercise without the wand. Put your helping hand under the hand of your healing arm and lift. The final exercise is done while standing. Hold the wand behind your back, palms up. Pull the wand up, keeping it close to your body. Then gently pull with your helping hand so your healing arm moves farther behind your back. Move your healing arm only as far as you've been told. Do not move it to the point that you feel increased pain. Your surgeon or physical therapist may tell you to use a rope and overhead pulley to do some active assisted exercises. Be sure to securely fasten the pulley according to the manufacturer's directions. Sit with the pulley above and slightly behind you. With your healing arm resting comfortably at your side, grasp the handles or end of the rope in each hand. Turn your hands so your thumbs are on top. The elbow of your healing arm should be slightly bent. Slowly pull down on the rope with your other arm to raise your healing arm forward and upward. Move it only as far as you've been told. Do not move your arm to the point that you feel increased pain. Hold for 10 seconds, then use the pulley to slowly lower your healing arm. As your arm grows stronger, you may be able to raise your arm and hold it upright with less support from the rope. Faithfully doing your active assisted exercises is an important step in helping your shoulder heal.